Good evening, everyone, and welcome to a special edition of Back to Basics. I'm Dr. Vivian Asamoah. I'm a functional gastroenterologist in Katy, and we are so lucky tonight to have a special guest, Ashley Hurst, who is a registered dietitian, also in Katy or just in Houston, Ashley? Where are you?
Yeah, I did have an office in Sugar Land, but now I'm virtual. So kind of everywhere.
Okay. Oh, yeah. Fantastic. Mm-hmm. So Ashley, it's really nice to have you on. We have a couple mutual patients, and we sort of started connecting and discussing cases and discussing ideas. And I thought, she would be a really great person to teach us all a little bit more about food intolerance. And Ashley, start off by telling us a little bit about yourself and your practice.
So I'm a registered and licensed dietitian, and I work with people with gut disorders. Specifically, I'm specialized with Crohn's and ulcerative colitis, but I do see all kinds of patients. So I see people with acid reflux and small intestinal overgrowth. Mm-hmm. So I see all kinds of things. And I've been in practice for about 7 years now, and in the Sugar Land area. And then last year went virtual. So that's kind of what I do.
Awesome. So your main focus, definitely gut, but really a focus on the patients with inflammatory bowel disease, right?
Yeah. Yeah, about half. Yeah.
About half. Okay. Mm-hmm. And you said today was actually World IBD Day?
Yeah. Yeah, it's World IBD Day. Yeah.
Oh, awesome. So anything special happening for you? I know they're always having like 5K runs, marathons, different events going on, probably more so virtually, right?
Yeah. I'm doing an Instagram live this evening.
Oh, nice.
With at the Crohn's and colitis dietitian on Instagram.
Okay.
So I'll be doing that tonight, but yeah, otherwise it's just been a normal work day for me.
Okay. All right. Yeah. That's awesome. So Ashley, I think, we kind of been trying to make the distinction between food allergy, food sensitivity, and food intolerance. And so we kind of went through food allergy, true food allergy, IgE mediated, and then food sensitivity, more the IgG mediated, right? Immune response causing intestinal permeability issues. And I think a lot of times when people also refer to food allergy in layman's terms, sometimes they mean a food intolerance. So I think, a registered dietitian with a lot of expertise is the best person to hear this from. So tell us, in your experience, what is truly a food intolerance, and how do people, what are some of the common food intolerances that you see?
Yeah, I think the main distinguisher is how long from the time that you consume the food to when you have a response. Mm-hmm. A food allergy is going to be fairly immediate, but food intolerances could be, few hours later, a couple days later. It could be something like that. And food intolerances could present differently than food allergies. It might not be throat closing up or high heart rate, but it could be, ongoing headaches or rashes or just intense gut distress. It comes out in lots of different ways. Mm-hmm. So I think those would be kind of the differences between how do you know which one you have?
Right.
Yeah.
Good timing. So one of the most common food intolerances that we see day to day is probably the lactose intolerance. True? Where people have a lactose intolerance?
Yeah, I think that's the more common one. Mm-hmm. But I feel like in the gut population, specifically with Crohn's, I see a lot more of fructose intolerance as well. Mm-hmm. Mm-hmm. I think the statistic is like about half of people with Crohn's also have like that fructose malabsorption. Mm-hmm. So I see that. I occasionally see that in people with IBS too. So people mm-hmm. that just don't do well with fructose.
Yes. Yes, yes, yes. What do you think are some of the common causes of why people develop intolerance? Because people will often say, I was able to eat dairy when I was little, and now all of a sudden, could this really be an intolerance to fructose or even to lactose? What do you think are some of the common reasons that you see?
I personally think it's a lot may have more to do with like the gut changes that occur, or the gut bacteria changing over time, or an unbalanced gut flora that can contribute to more of that intolerance type stuff. And some people even develop more of like allergy type responses later in certain people who have real sensitive digestive tracts. So I think it mostly has to do with that. And I think people can see improvements too in more the food intolerances once they start making some changes.
Okay.
In terms of dietary changes.
Dietary changes. So bacterial overgrowth, dysbiosis, fungal overgrowth is what may typically predispose someone to developing an intolerance, right?
Yeah. That's a good point.
Or they really just don't have the enzyme, right, to break down the lactose, the sugar itself. But one thing we also know is that you can lose this enzyme activity based on how healthy your gut is, and you can restore the enzyme activity when everything heals up and the gut is healed and healthy again, right?
Yeah.
So there was an interesting study, and I don't know if you saw this one, on people with kind of mild to moderate dysbiosis, and dysbiosis just being an imbalance in the gut microbiome, like some bad bacteria. And they actually treated with just, a combination of soluble and insoluble fibers. And then, of course, cleaned up the diet, right? And they actually had a large population of people who had lactose intolerance, right? And after they did this clean up healthy diet for about 3 months, they noticed that a lot of the people with fiber being the main constituent in the study, they noticed that people who had lactose intolerance, it actually just reversed. Like they were able to now tolerate dairy and everything just by changing the gut microbiome, which tells us how much the gut microbiome, how much those bacteria and trillions of bacteria in our gut are so critical in the functioning, in how the enzymes even work on the brush border, right? And how well they work on the brush border. So I thought that was actually really interesting that this was reversible in some cases.
Wow. That's really interesting.
Yeah. Do you see people with high histamine intolerance? What do you, in your experience, what is a high histamine food? How do you start thinking whether someone has a histamine intolerance or not?
Yeah, I think I do see occasionally people that are real sensitive to histamine type foods. And I've also seen people that are sensitive to, kind of along that same lines, tyramine rich foods, which are things that are fermentable, or things like, an example would be kombucha or alcohol, that sort of thing. So I've seen kind of both of those camps, and typically, so in the short term, we might do like a lower histamine diet to kind of help relieve some of the immediate symptoms. But in the long term, I try to bring in some strategies. I do some prebiotic fibers, and we make some changes with the diet as well to kind of help support the gut microbiome. And usually over time, that's, kind of more of the long-term approach to working through that. But yeah.
What are some examples of high histamine foods for people who may not know what a high histamine food is?
High histamine food, cheese, sauerkraut. Trying to think of you're catching me at the end of the day, so.
Yeah, our brains are like.
Yeah. I know cheeses, sauerkrauts, pink pickles, I think lunch meats, like lunch meats as well.
Okay.
Yeah.
Dried fruits.
Dried fruits.
Spinach.
Yeah.
So those would fall into that category. Yeah. And alcohol I'm seeing is one. Avocado is one we don't think of all the time.
Yeah.
I think is a high histamine food as well. Yeah.
Yeah. And I've also seen, something else that I've seen it's not as always as obvious is stress and its impact on all of these things, because if you're eating in a stress state, you're going to be producing a lot less enzymes. Like in the mouth, I think it's like about 75% less salivary amylase or 50% less. I can't remember, but that's significantly less, and that's going to impact how well you digest foods too. So that's another thing I usually check on before I go into, a low histamine diet. I always check what state do you usually eat in? Do you eat when you're, driving, or do you eat after, you've been through something stressful? Do you do anything to kind of calm down your nervous system?
And I mean, very often we're eating on the go, like you're saying, like in the car, driving, or even at lunchtime, we have we're eating like while we're on the computer typing. So we haven't totally relaxed the entire mind, the whole parasympathetic, as they say, is still, going fast. So I can imagine that does not help with digestion overall, right? Yeah.
Right. Yeah.
Yeah. We have a question. Someone asked why mushrooms all of a sudden would start creating symptoms for the gut. I guess an intolerance, right? Someone who eats mushrooms all the time. I wonder, would it be like a different type of mushrooms? Like, why would mushrooms all of a sudden start creating symptoms? I suspect probably there could be some gut issues like dysbiosis, and then kind of, intolerance. And we also learned about oral allergy syndrome, where, there could be a cross reactivity with certain vegetables, plants, or whatever, and cross react with certain foods as well. So that could be another issue, depending on if the person has sensitivity. Yeah. What's been your experience with gums and food additives? So I'm kind of going into the smaller things that we can find sometimes in food products, and people having intolerance to those things.
Yeah. I mean, I think it's a spectrum. So with additives, there are some, like I'd say polysorbate 80 and carrageenan and those sorts, that it seems like we have a well-established knowledge that they do disrupt your gut flora. They do disrupt the gut barrier. Things like gargum, on the other hand, I think is more of an irritant than it is like inflammatory. From my understanding, gargum comes from a bean, so it may cause a little bit of gas in certain sensitive people, especially in large amounts. I think the amount's really key too. If you're having a tiny bit here and there versus every single thing you have, and large amounts of it might create a much different impact. So that's kind of, I'd say it all depends on how much you're having, of these things too.
The quantity. Yeah. So if someone has an intolerance, you would advise them sort of, how, as a dietitian, how do you approach it? Because, we're seeing a lot of people have or believe they have intolerance to multiple different foods, right? And we're also seeing that a lot of people are over restricting what they're eating because they're like, I can't have this. How do you work with people who believe they have multiple intolerances? Do you do food sensitivity testing? Do you do elimination? Like, how do you kind of figure it all out when they believe they have histamine intolerance, a salicylate intolerant, oxalate intolerant? It can become a lot because then you're restricting so much. From a nutrition standpoint, how do you handle that, Ashley?
I think I've changed on that over the years. I think in the beginning I did more testing and would focus on pinpointing what those things are. But the more that I learn and watch how people responded and look at gut microbiome research, the more that I think sometimes it's about the food and sometimes it's not about the food. Sometimes it's just we need to work on the things as a whole. We need to focus on reducing inflammatory things and increasing plants that help create things like butyrate, which help to reduce inflammation, in the digestive tract. So sometimes we have to step back and see the big picture, that it might not always be about the food. And sometimes it is. Sometimes it's like, if someone really feels like they have a bad response with a certain food, sometimes we need to actually pinpoint what those things are. It could be an allergy, or it could be just something that doesn't work well. So I think using a combination of those approaches is really how I approach it.
So do you still use a lot of food sensitivity testing, IgG food sensitivity testing, or even LEAP or ALCAT?
I used to, but I haven't in the last couple of years, because I think I'm finding that it can be more restrictive, which leads to, sometimes that's okay in the short term, but sometimes it can be too overly restrictive and kind of push people in the wrong direction. So,
So less of it. Okay.
Yeah.
Okay. And when you are, so what I hear you saying is that, you try not to, you kind of focus on the whole picture, right? Trying to bring in a healthier microbiome by choosing foods that are going to enrich short chain fatty acids like butyrate in the gut, and then reducing and removing all the inflammatory foods, pro-inflammatory foods, instead of pinpointing on specific food groups and doing a sort of an overhaul elimination. Kind of balancing things out in the gut is what you really try and do. And right?
Yeah, I mean, it all depends on who it is too. I think, if it's somebody with like eosinophilic esophagitis, which would require more of an elimination style approach typically in the beginning. But other people, I usually try to start with the simple stuff first. And then if that's not working, kind of dig in a little deeper.
Okay. And in the patients you see a lot of, the patients with inflammatory bowel disease, what have you noticed? Have you noticed any sort of like common trends in terms of their gut microbiome? In terms of, are you seeing more dysbiosis? Are you seeing fungal overgrowth? Are you seeing pancreatic insufficiency? Or does it just depend on the patient, on the person?
I definitely see a lot of bacterial overgrowth when people are in flares. Definitely see that with a lot of bloating and that sort of thing. That's probably the more common thing.
And when we are talking about food intolerance, it appears that when you heal the gut and restore the balance in the microbiome, do we see most of these intolerances go away, kind of disappear, where people are now able to eat most foods again?
Yeah, I mean, that's been my experience with it. My experience is that oftentimes, and I've experienced this too as a patient, oftentimes it can feel like you have to take out everything when your gut's reactive. But oftentimes we take out too much. It may not be about the things. It's, I think over time, if we work on doing things that will allow your gut to have a better response. I mean, I think that I'm definitely seeing that some things that we thought were triggers were not actually triggers. So it's sometimes you have to look at, oh, well, maybe it's not the blueberries or the spinach. Maybe it's the dressing that I put on top, or, looking at it that way.
Kind of teasing out. Okay. Well, I hope this was helpful to most. I know that it is Wednesday night. We're all trying to get out of here, get out of work. I see you're still at work. Ashley, is there anything else you'd like to share with the Natural Gut Relief group this evening?
I don't think I have anything, but yeah, thank you for having me and letting me come on here and chat about gut stuff.
Thank you so much. Thanks for coming on. It was really nice learning from you, and I think our approaches are very similar in a lot of ways. In the way I think you really look at the big picture in terms of what you do, and kind of look for optimal healing for your patients, sort of long-term, realistic, optimal healing for your patients. So thank you so much, Ashley Hurst, for coming on tonight. And I hope we get to see you again, and have a wonderful Instagram Live. Where should people be going to check you out if they want to see more of this on Instagram?
Yeah, so I'm at the Crohn's and Colitis Dietitian on Instagram.
On Instagram tonight. What time does it start?
At 7.
7.
So
okay.
30 minutes.
30 minutes. All right. Thank you so much, Ashley.
Have
a wonderful evening. Have a wonderful weekend.
You too.
Bye-bye.